Moms-to-be with herpes, the odds are in your favor. Genital herpes is your average stalker. It is always unwanted, good at hiding, and sometimes unknown. Genital herpes is a sexually transmitted disease (STD) caused by either type of the herpes simplex virus, HSV1 or HSV2, but it is most commonly caused by HSV2. Less than 1/4 of the people who are infected with HSV2 know that they carry the virus, because most people do not even experience outbreaks. When you are pregnant or plan to become pregnant, your baby's safety and health is your top priority. Genital herpes can potentially be a threat to your baby's health and can be fatal in some cases. What are the symptoms of herpes? Tingling or itching around the genital area. Blisters of ulcers around the genital area. Flu-like symptoms, headache, muscle ache, fever. Vaginal discharge. Stinging sensation when peeing. Swollen lymph nodes. If you get infected before pregnancy, if you have genital herpes before pregnancy, it is very unlikely that you will infect your baby during pregnancy. If your only worry is your genital herpes, then your baby will probably be born completely healthy and beautiful. Your baby is safe from the virus because your body has already created the antibody needed to fight the virus. The immunity is then passed to the baby while you are pregnant. If signs of an outbreak appear in the last few weeks of pregnancy, a cesarean section C-section may be an option, and you will be put on a tablet called aciclovir to help manage the outbreak. Aciclovir helps with discomfort and can increase the healing process. If you contract herpes in the first or second trimester, if you get infected with genital herpes for the first time during your first or second trimester, your baby still has only about a 2% chance of contracting the infection. The biggest concern when becoming infected with genital herpes in the first few weeks is the chance of miscarriage. If you happen to get infected with genital herpes during the first or second trimester, your doctor will probably prescribe an antiviral tablet called aciclovir. Even though this medication is safe during pregnancy, to be on the safe side, doctors will most likely not prescribe it to you unless your outbreak is severe. Your doctor will continue to monitor you throughout your pregnancy. If you get an outbreak in the last few weeks of pregnancy, a cesarean section C-section might be considered to prevent infection to the baby. If you get infected late in the pregnancy, getting infected with genital herpes while pregnant in the last few weeks of pregnancy is the time where the herpes transmission rates increase greatly. In the last 6 weeks of your pregnancy, your body has not had enough time to create antibodies to protect the baby. If you have a vaginal birth, your baby could get the virus from an open sore. The herpes transmission rate is 30 to 50% with newly infected moms-to-be in the last 6 weeks. You will be put on aciclovir and monitored for sores and other signs of an outbreak. If your newborn is exposed to herpes, it is called neonatal herpes. Neonatal herpes most often result from moms-to-be not knowing they are infected. The severity of the infection varies. About 1/3 of the time, a baby that gets herpes from their mother during birth gets an infection in the mouth, eye, or on the skin. These infections are easy to treat with intravenous medicine, even though the baby will always carry the virus. Another third of the babies infected with herpes during childbirth experience problems with their central nervous system. Within 2–3 weeks after childbirth, the baby may experience fatigue, seizures, poor feeding habits, and irritability. The last third of the babies infected during childbirth experience disseminated herpes, which infects multiple organs during the first week of birth. Even if babies with disseminated herpes get prompt treatment, they often experience brain damage or it may even prove to be fatal. Top 5 herpes triggers. 1. Vigorous sex. Friction during sex can irritate the skin and bring on symptoms. 2. hormonal changes. 3. Weak immune system, illness, surgery, etc. 4. Diet. 5. Stress. How to protect your baby from herpes. Safe sex. Practice safe sex during pregnancy. This means using a condom and avoiding oral sex. Be informed, know the status of your sexual partner during pregnancy. Get tested, if you plan on becoming pregnant, you are pregnant, or you want to have sex during pregnancy, you and your partner should get tested for STDs so you will know your status and how to properly protect you and your baby. Wash your hands. When you experience an outbreak, make sure to wash your hands before touching the baby, especially after touching infected areas. Be on the lookout for outbreaks. If you have an outbreak around your mouth, avoid kissing your baby, and tell others with cold sores around their mouth to do the same. Genital herpes can be an embarrassing thing to deal with, especially during pregnancy when it has to be addressed. Just remember that there is an extremely low chance of your baby contracting herpes from you during childbirth. Even with that in mind, you should be on the safe side and inform your doctor. If hygiene. Stay positive, the odds of your baby being a happy and healthy baby are very good.